Hi, this is Tom Shannon. I'd like to talk about the state of prostate cancer currently in Western Australia. First of all, it's important to understand exactly what the prostate is. The prostate's a gland that sits just beneath the bladder and above the penis, deep in the male pelvis. As a gland, it produces fluid, which is very important in order to have children. And once you've had your family, the prostate really doesn't contribute much to your health. It mainly causes problems from increasing in size, and as you can see from this picture, there's a channel through the middle of the prostate that allows you to pass the urine through, and as you become older or the prostate increases in size, it can become more difficult to pass urine through. But today we're going to talk about the other major problem that prostate cancer can cause, and that is the development of prostatic carcinoma. Prostate cancer is a major problem in Australia with 20,000 new cases in 2009. There were also 3,000 deaths, making this the second most common cause of cancer death amongst Australian men. The lifetime risk of developing prostate cancer is now 1 in 6, with a 1 in 34 lifetime risk of death. 1 in 6 new diagnoses will also be in men under the age of 50, making this a disease primarily of significance to younger men than the older men that we'd previously associated with prostate cancer. So what's the natural history of prostate cancer? We've all heard the adage that you die with, not from prostate cancer. Well, prostate cancer is truly a heterogeneous or mixed disease. There are some cancers that will kill you very quickly, and there are other cancers that will be slow growing. Prostate cancer is highly curable if detected early. If the prostate is containing a cancer that's confined to the prostate, then invariably it can be cured. Slow-growing cancers may never cause harm, meaning that you can be diagnosed with cancer probably later in life, especially if this is slow-growing, and you may die of something else and never develop symptoms from your prostate cancer. All the treatments that we have will have side effects, so it is by no means a certainty that once you're diagnosed with prostate cancer that you'll be recommended treatment. So what about prostate cancer screening? We have a blood test that is very effective at detecting prostate cancer in its early stages. As prostate cancer is a mixed or heterogeneous cancer, this makes the justification for screening more difficult. To explain that, it's important to realise that with any screening test that's done, be it for prostate, bowel, breast, that we must debate the benefit of the screening test versus the harm that can be caused by the subsequent intervention. So if a cancer is generally low risk to you, it would certainly appear that screening can do more harm than good. If you were to screen a population and find a lot of cancers that were never going to cause trouble, and yet generate a lot of operations and a lot of side effects, then we aren't really helping patients by doing that sort of testing. If, on the other hand, your cancer is going to kill you, then it's very beneficial to detect that cancer early whilst it's still curable and intervene, and therefore that sort of prostate cancer will respond very well to being detected early and therefore to be screened. And this is where the controversy lies. Because prostate cancer is not just one disease, because the outcomes aren't universally fatal, we're hit with this dichotomy or mixed picture. Some men will benefit from prostate cancer screening and some men will not. And it's not possible to determine who that is before we investigate. There have been a number of screening studies now done to try and answer the question of risk versus benefit for men with prostate cancer. And I am going to discuss the findings of these studies. There were 2 large studies which reported data in 2009. It's important to note that this was early data, being at 7 and 9 years. You would expect with a prostate cancer screening study that you would need to be waiting approximately 15 years to see the significance or impact of the intervention. And this is because even if you are diagnosed with prostate cancer, it may be some time before that prostate cancer can kill you, as we have first, second and even third line therapies, and men can remain alive for many years after the diagnosis. The first study was a European randomized study of screening for prostate cancer, or the ERSPC study, and the second was the prostate, lung, colorectal and ovarian cancer screening trial, or PLCO for short, from the United States.